Hello, everyone. My name is Dr. Ferghal Armstrong, and welcome to Lifestyle Matters. And we have with us Ms. Charmmy Cheng of the Dietitian's Kitchen. So, Charmy, I thought we'd speak today about sodium. So, first of all, can you tell us exactly what is sodium?
So, sodium is a chemical term, or we usually understand in our general life. People think sodium, they will think of salt, and salt
Hmm.
is made from sodium chloride.
All right.
Sodium is really important. It's a mineral and it's really important for our body. We need
Hmm.
sodium, but we don't want too much sodium.
Yeah. So, let's just hone in on the difference between sodium and salt. So, sodium is only half of salt. So, therefore, the recommended limits for sodium consumption, they need to be doubled roughly if you're considering the actual weight of salt. Is that correct?
Yeah, probably, yeah. Because the component of the salt is sodium chloride. So when we
Mm,
think about the amount of sodium in salt, probably around half. So general,
yeah.
the recommendations talking about sodium is 2,300 milligrams. But when we talk about salt, we will talk about 5 to 6 grams. So it's
Mm,
almost double. Yeah.
yeah, yeah. And so you've said that it's really essential for life, really, and but it too much it creates harm, and too little, of course, it creates harm. So let's talk about what happens if you have too little sodium in your diet. What happens then?
Yeah. So if we see some people go to do sports and they sweat a lot,
Mm,
and then they come back if they don't drink any sports drink which have some electrolyte to get their sodium and other mineral back, the consequences maybe they get muscle cramp or
mm,
they can get very dizzy. It's
mm.
because that our body need this sodium, magnesium, these electrolytes to help to work. Our neural systems and our
Mm.
muscle, our cell all need these minerals
Yeah.
to do the reaction. Yeah.
So really, sodium is necessary for neuromuscular function and brain function. And if you've
Yeah.
got too little sodium, you're prone to cramping and also dizziness and feeling weakness. And I mean, and I have a number of patients who are diabetic, and they all say, "Oh, I feel dizzy and weak, therefore I need to take glucose." Well, actually, more often than not, in my opinion, they're feeling dizzy and weak because they're not taking enough sodium, especially when it's a hot day and they're drinking lots of fluids without sodium content in it. Now let's move on to the other side. So having too much sodium, what problems do we understand are associated with too much sodium?
Yeah. So sodium, imagine sodium's at like a sponge in our body and it will retain water. So the
Mm,
reaction of sodium in the body, it retains water, and consequently that can increase the water content or increase our blood flow in the body,
mm,
and the blood store in our bloodstream. So that
mm.
consequently that's increase the blood pressure, causing hypertension.
Yeah, yeah. So high sodium, or having too
Mm,
much sodium is associated with
yeah.
hypertension.
But our kidney will eventually work it out to remove the sodium, but it's gonna take a
Mm,
while to do that. Yeah.
yeah. And actually, having too high a sodium intake per day is actually one of the it's actually associated with a global disease burden on all-cause mortality. So actually, it's a very important issue. The minimization of sodium ingestion for most people to those limits of 2,300 milligrams of sodium per day. But for those with pre-existing hypertension, the sodium limits are actually lower. Would you care to talk about that?
Yeah, for people with like hypertension, is they
Mm,
probably their doctor recommend them to follow a 1,500 milligram recommendation.
mm,
So that's even
yeah,
lower. Yeah.
yeah. So really, a low sodium diet is part of the treatment for hypertension. And
Exactly.
that
Yeah.
really brings us on to the concept of how we can actually use diet for people with high blood pressure. So, can you tell us a little bit about what kind of diet we can use to treat hypertension?
Yeah, that's actually a type of diet. We call that the DASH diet. And the
Mm,
DASH diet is actually called the Dietary Approaches to Stop Hypertension diet. And
mm,
this diet is particularly designed to help with hypertension. So, in not just
mm.
preventing people will get hypertension, but it also helps to reduce their blood pressure. But not just
Yeah.
about blood pressure, it also help with other chronic
Mm,
issues like generally help people to lower their cholesterol level, help with the weight
mm,
management, and yeah,
mm.
etc. Yeah.
Yeah. All right. So we've heard that the DASH diet is part of a dietary approach to dealing with specifically hypertension. But what's actually in it? How would you describe the diet per se?
So we can see there's a
Mm,
lot of fruit and vegetables, whole grain, um, fat-free or low-fat dairy, fish,
yeah.
poultry, beans, and nuts and seeds and vegetables. But we should also look at the right-hand side is the limited thing that we should not have too much in the diet, which is the fatty meat, full-fat dairy. These two is try to help us to reduce the saturated fat intake and also try
Mm.
to limit the sugary drinks, sweets, most importantly, sodium intake.
If I could just pick your brains there for 1 minute. So we've already said that people with hypertension really need to
Mm,
limit their sodium
yeah.
to 1500 milligrams a day. Within that DASH diet, is the limit of 1500 milligrams applicable to that DASH diet, or is it the same, or is it different?
Dash diet is 2,300 milligram.
Milligrams.
Yeah,
So
milligram.
even though the DASH diet's designed for hypertension,
Mm,
it doesn't actually follow the lower recommendation of sodium. Is that right?
no, yeah, you're right.
Yeah, yeah. So
Because like
obviously, it's not just the sodium issue in the DASH diet. It's an all-encompassing diet aimed at treating hypertension. That's what I'm hearing.
yeah, and even 2,300 milligram is very little, and not many
Hmm.
people can achieve this goal.
Yeah. So what does 2,300 milligrams look like in terms of actual sodium? How much salt is that?
It's about 1 teaspoon of salt, like
Yeah,
five to
and
six
that's
grams.
so a teaspoon of salt for all your food prep. So there's no added salt on the table. You need to throw away the salt cellar on the table.
Mm,
And you can't eat any processed food because this processed food is full of salt.
yeah.
And you can barely cook with a pinch of salt. That's really what we're hearing, isn't it?
It is true, yes. Yeah, and also you
Okay.
can't use any sauces like, no soy sauce, no oyster sauce, no ketchup, no barbecue sauce.
Yeah. Yeah. It's quite limiting, isn't it, when you really start to look at that. So let's go look into the specifics of the DASH diet, because we've seen the eating plan. Now let's look at the specifics.
Right. So there's a specific portions or serving size we can look for. So you can see from the food group we just mentioned from the eating plan, there's a range of the serving size here. For example, the fruit you're looking for 4 to 5 serves a day, and on the
Yeah.
right column you can see what is meaning of one serve. Like a one medium-sized fruit is considered as one serve. There's a range here because for the DASH diet, it also helps with weight management and depends on people's energy requirement. We will decide different serving size for the individuals. Therefore, there's a range here. So if people have a lower energy needs, they will go for the lower end of the serving size.
So it's not just 4 to 5 of fruits a day. It's also 4 to 5 of vegetables. It's
Yeah,
6 to 8 per day of grains. So there's a lot of emphasis on vegetarian products and also fiber products. But then the limited foods include 2 or fewer a day servings of lean meats, poultry, and fish. So all that's the protein.
yeah.
And but interestingly, we got 2 to 4 servings of low fat or non-fat dairy foods. Can you talk to me about that? What does that look like?
1 cup of milk like it's around 250 milliliter is one serve, and then maybe a
Yeah,
one small tub of yogurt, that will be one
yeah.
serve, or two slices of the square shaped cheese, that will be
But
considered
that would
as one
be
serve.
but that would be low fat yogurt or low fat cheese, wouldn't it?
That's correct. Yeah,
No,
the
no,
light
no.
version.
I'm not a dietitian, but I don't actually believe that low fat yogurt or low fat cheese tastes nice.
Well, some of them taste pretty good. Uh,
Yeah.
yeah, but sometimes they might add a little bit extra sugar in it to compensate the
Mm,
fat loss. So have to read the food
yeah.
label. Yeah.
Yeah. And that's the thing about fat-free foods or low-fat foods. To maintain some kind of palatable taste, a lot of the time manufacturers replace fat with actually sugar, don't they?
Yeah, unfortunately.
And
Yeah.
yeah, and that completely, there's absolutely no benefit, certainly speaking from a cardiovascular health point of view, there is no benefit in replacing fat with refined sugar to achieve palatability.
Mm.
The other thing that I find interesting on this diet, and if we're looking specifically at the diet plan, 4 to 5 servings per week of nuts, seeds, and legumes. So that's less than one serving a day. I mean, I love nuts. I eat nuts every day. And from a heart point of view, I think nuts are quite good for you. What would you say to that?
I agree. Yeah. Because nuts have a really good fat in it, maybe omega
Mm,
3, omega 6, really
yeah,
good quality fats and fiber as well. Um,
yeah.
but but these good fat are more focusing on helping with brain health, and
Mm,
having too much nuts, because fat are fat, they will put on weight, they will make people gain weight if you have too much fat,
mm,
unless you're going to
mm,
compensate with other fat intake, use less oil, try to compensate, reduce other side of the fat, then you can have more
yeah,
nuts. Yeah, but generally,
yeah.
like one serve of nuts a day is completely fine. So it's talking about 4 to 5 per week, which is equivalent to one serve, around one serve a day, and then maybe you got 2 days nut free.
2 days not free. All right. So, we in previous episodes we've talked about, for instance, the Mediterranean diet. How would
Mm,
you, and bearing in mind that the Mediterranean diet was specifically designed to help people with heart disease, ischemic heart disease, angina, heart attacks, or in fact those people who were at risk of angina or a heart attack. This diet is specifically designed to help people with hypertension. How would you compare the two? What comparison would you make?
mm. Looking at the eating plan, actually, they looks quite similar because they both have a focus on a lot of fresh fruit and vegetables, whole grain
Mm,
products, go for the lean meat and some nuts and seeds. But the difference is the DASH diet, it's really have an emphasis on your sodium intake. It has a
mm,
limitation or recommendation of how much salt you should be taking daily.
mm,
And the Mediterranean diet didn't really mention about salt. Another
mm,
difference will be the fat. In DASH diet, as I mentioned, that it also help with weight management. So we have some calorie calculation here. So we're not having so much fat in it. There's all calculated. So that's like a limited fat intake, limited nuts, and we are focusing on low fat or reduced fat dairy products here. Um, in the Mediterranean diet, it's more focusing on you should use a good fat like your olive oil or eat some fatty fish. So there's
mm.
different approaches. Yeah.
Yeah. And it's really important to emphasize there's different approaches for different therapeutic indications. And really, I think it's also important to emphasize that for the most part, there's no specific food that is absolutely contraindicated. It's all about a diet plan. It's the overall diet composition that's important. Now, I mean, you've just said that the key thing about the DASH diet is the low sodium. Now, let's talk about occult sodium. You mentioned a number of products, a number of food products earlier on that had a lot of sodium in them. Where do we find sodium in our diets that we might not expect?
Wow, too many. Too many. Basically, any types of packaged processed food in a package, you might expect some sodium in it. Yeah, even
Yeah,
a canned, like a can of vegetables, you got sodium in it.
yeah,
Yeah, so it's
yeah,
everywhere.
yeah. Why is that? Why is sodium put into processed food?
Well, one of the reasons that sodium they use for preservative, so it's really
Yeah,
important. It can increase the shelf life.
yeah,
And another reason would be just taste, because sodium is really cheap and it added to
right,
the food to enhance the taste. Yeah.
right. So specifically about Asian condiments, where do we get a lot of sodium?
We love sodium. When you think about like soy sauce, oyster sauce, chili
Yeah,
paste, fermented tofu paste, fermented shrimp paste, everything, they're just very salty. Yeah.
yeah. So
Yeah.
does that mean that if you're really going to adhere to the DASH diet, that all of those foods are just contraindicated? I mean, is it possible to actually have those tastes in your diet
Yes, you
while
can
still
still add
adhering?
some. Thanks for the technology. Now we have reduced sodium soy sauce. We
Yeah,
have low sodium oyster sauce. It's the
yeah,
amount of how much you're putting in your food. So home cooking is always the best because I think you can control how much sauces you're gonna put in your dish. But when you
yeah,
eat out, Asian cuisine are generally quite high in sodium. Not just sodium, but
yeah,
also maybe MSG or other seasonings. It's just so
yeah.
hard to avoid when you eat out. But definitely
Mm.
do it at home. You can control.
Right, right. So what I'm hearing then is in terms of tips to implement the DASH diet, especially in Asian cuisine, the key
Mm.
thing is to consider cooking at home and use low sodium options. Are there any other tips that you might suggest?
Mm. I would say try to do a meal plan. So
Yeah,
if we can do the meal plan ahead before you go for grocery shopping, and then that's probably better, easier, so you can plan your week and get the ingredients. Try to get the fresh ingredients. Do the
yeah,
cooking, just mindfulness cooking. Try not to add so much salt, but you can use other uh, herbs and spices. Use like onions, garlic, and different herbs added to your
mm,
cooking. And
mm,
also, I think reading food label is a very important skills for to help us to pick the good products that has less sodium.
yeah, yeah. That's an art in itself, isn't it? I mean, there's a number of issues to discuss with that. Firstly, the amount of sodium per serving versus the amount of sodium per 100 grams. Can you talk us through that?
So when we see the food label, usually that's two columns on the food label. One side is
Mhm.
per 100 gram or per 100 ml. The other side is per serve. So it depends on what's the purpose for us to read the food label. If we are going to compare products, we always look for the per 100 gram or per 100 milliliter side because we need to standardize the unit so that we can compare the products. So
Yeah.
look into the food label when we look into the sections called sodium here. And then you can see this
Mm.
example saying there is 250 milligrams of sodium in 100 gram. So that's
Yeah.
not so bad. But there's some number we try to remember. So if a product it got 120 milligrams or even less than that, it's a really good product. It's called a low sodium product.
Mm.
Anything is like less than 400 milligram per 100 gram, they are still good. They're still pretty good.
Yeah.
But I give you an example what product you can never find this number. It will be your canned soup and also maybe processed meat. For example,
Yeah.
spam. Everyone heard about
Mm.
that? Spam.
Yeah.
Spam, even they have a 25% reduced sodium version. For 25% reduced version, they still have roughly more than 1,000 milligrams in 100 gram.
Holy moly. That's a
Yes.
lot.
So yeah, 100 gram basically is around half of the can, half of the tin.
Yeah.
Yeah, that's more than
Yeah.
1,000. So basically, if people on a 1,500 restriction, half tin's done.
That's it. Yeah.
Yeah, and also there's something that we is quite tricky when we look into the when we're going to shopping. There's some things not called salt, or they don't even have sodium on it, but they actually got sodium in it. So it's called maybe baking powder. People can't imagine baking powder got sodium in it, but baking powder's
Yeah.
main ingredients is a bicarbonate sodium. So
Yeah.
that's got
Yeah.
sodium in it. Other things
Yeah.
like celery salt, pretty obvious, got salt there. Or MSG, people think no, MSG is different, they're not salt. But MSG is like monosodium glutamate, it got sodium in it.
It's got sodium in it. Yeah.
Yeah,
So we need to move away from thinking about salt to thinking about sodium. And
yeah.
that's why
Sometimes
we've,
not just sodium and salt, because like when we call like you want to get the vegetable stock or beef stock, chicken stock, that's got no sodium or no salt on the name, but it got a lot of sodium in it.
yeah, yeah. So just read the label. One of the things I like about what you said is that you actually use the per 100 gram figure to compare foods, but you use the sodium content of the packet to actually look at the food that you're consuming on your daily sodium tally. So that's why you need the two figures. One's
That's
for
right.
comparison, the other one's for your own personal health
Yeah.
and to make sure you stay underneath the maximum.
Yeah, so you have mentioned that for another purpose that when we need to look for the per serve is maybe when
Yeah,
you are doing a meal plan, you have mentioned that, and you want to calculate how much you are eating, you're consuming, then this point we move to the per serve for our own calculation.
yeah,
It's just easier because the per serve, for example, talking about a packet of cracker, and then it's
yeah,
like maybe it will tell you like 4 pieces of cracker is one serve, and it's just easier for you to imagine to look for the exchange. How do you exchange how many milligrams of sodium I'm having for these 4 slices of crackers? Yeah, if that
yeah,
makes sense.
yeah,
So we got
yeah.
different purpose to look for in the column.
That's why we got different figures for sodium. And it's really important to emphasize that sodium is not salt. If you think about the grams of salt that you're allowed, it's possibly double, but that because it's salt includes sodium chloride. Another thing I want to just ask you is a lot of people say to me, "Oh, I'm using high quality salt. I'm using expensive sea salt." Could you just comment on the role that sea salt or high cost salt products, is there any health benefit to that?
Health benefit. It makes you feel
Yeah, I
better.
mean, all right, but in terms of if you're trying to limit your sodium content, using sea salt or natural organic salt is
Mm,
it's meaningless. Yeah,
yeah, because it's still made from sodium chloride. If you break it down,
exactly.
it's still the same chemical. But the difference
Yeah,
is probably it got some other minerals in it. Like, for
yeah,
example, people say, I like to use the Himalaya pink rock salt. It sounds so
yeah,
fancy.
yeah,
But yeah, it got the color, so I'm assuming that it got some other nutrient in it, maybe a
yeah.
little bit iron.
Uh,
Yeah,
all right,
but it
all right,
doesn't
Charmy.
really make a difference.
So Charmy, do you want to just give us a quick summary of your thoughts around the DASH diet and how we can actually implement it in it's especially for Asian cuisine?
Yeah, I think sodium awareness is really important.
Mm,
If people who have hypertension, well, usually people have hypertension, they might have other chronic health diseases as well. It's
mm,
really important they should go to see a dietitian, and they go to see their GP and then also see a dietitian. And then the
mm,
dietitian can help you to tailor a plan for you if you really need to or you want to try the DASH diet. The dietitian can
mm,
help you to tailor a personal meal plan, which not just looking for the sodium, but also for the general total energy intake, making sure you have enough protein, enough fiber, drinking enough fluid in your diet. For sodium awareness is another thing that people really need to learn more or be aware of it when you're doing your food shopping. As I mentioned, they got different names on the package. So something we call that hidden sodium that you probably don't even know that exists in that food product, like a can of tomato maybe. They add salt in it. Yeah, I don't know why, but I recently realized there is something called no added salt version. So there's something you can talk to your dietitian and to learn about what kind of food products they are better. Is there a reduced sodium version? And sometimes a reduced sodium version can be quite tricky, like an example I mentioned, spam. So that's
Mm,
25% reduced sodium. Sounds good, 25% less, but it still has so many sodium in it. So that's
yeah.
something that we really need to learn how to read the food label to find the best product.
Charmy, I want to thank you for your time and wisdom today.
Thank you. You're welcome.
That's all for today, folks. This has been Lifestyle Matters.